Hi everybody, welcome back to my channel. If you're new here, welcome in. If you're coming back, I'm happy to see you again. I thought today we would talk about managers. Have you ever wanted to be a manager? Have you ever had a hard time with a manager? What were some things that that held you back from wanting to go into management? When you've been a nurse for a lot of years, it would make sense to want to maybe step up on the ladder. The things that have always held me back from being a manager have been the fact that you hold the phone and you have to answer it at all hours. You make your plans around when you're on call. And when you're a nurse that's on the floor in a facility, you're generally not taking call if you're not a manager. Most facilities don't have a call rotation for nurses. In like a long-term care setting where I know more about. But I did take a couple of positions that were management level positions. And I think at the time I really, even though I had a lot of nursing experience, I truly didn't have enough leadership experience to step into those roles. And I thought that I was ready for those things, but I wasn't. I did an MDS role, and it was really interesting, but there were a lot of deadlines, and when you're learning something for the first time, it's really challenging sometimes to meet those deadlines, and people expect you to know what you're doing. And at the time that I did MDS, they were transitioning into a new format. They were rolling out new Medicare guidelines. So I did not stay in that position. I also did an admissions director. And the requirements of that, I simply wasn't able to keep up with that either. And the thing is, the DON quit. And I thought I could do like an interim DON role, but I did not realize all the things that a DON does. And I think most of the time when we're working on the floor in a facility, we really don't know what the managers are doing. But a DON is making sure that things are running the way that they're supposed to. You know, the DON is making sure that the nurses are doing what they're supposed to do. And I've had many DONs work the floor, and in fact, when I was an assistant DON, I worked the floor many times. So the thing is, when a DON works the floor, they're still responsible to do their other duties. And I was not able to manage working the floor and figuring out those duties and pulling those reports and doing those things. Could I have learned those things in an unpressured environment? Sure. But in the environment that I was in, they really needed someone experienced to start things up because it was a new facility and they needed a DON that could handle it. And I got my feelings hurt. I really wasn't ready to be in such a role, even though I thought I could take it on. And I shied away from management for many years for that reason. Then, during COVID, I moved away from where I had been living and working and took on an assistant director of nursing role. I think if things weren't so tense with everything that was going on with COVID, maybe I could have picked that up a little bit better too. From the time that I started until the time that I left, I spent more time on the floor than I did learning and doing the duties that were expected of me. So I was supposed to log the infections and keep track of the infection control log and, do the infection trends. And I also tracked the COVID testing that we had to do weekly. And I was also responsible for doing the COVID testing on the patients and the staff, which was a role that I wanted to take on. Unfortunately, the facility that I worked at got an IJ right when I started, and they had a lot of turnover because COVID was intense, it was scary, and nobody wanted to take it home to their families, and people were dying. Not just old people, young people were dying, and that was frightening, and it was really hard to get people to come in and work. So everybody was working the floor. And when that's happening that you're running short and you're using agency in your building all the time, people come in and they don't know the patients, and they don't necessarily know the facility, and they don't necessarily know the regulations. Do I appreciate agency nurses? 100%. But they can sometimes get away with things that people that work on the floor and that work for the facility can't get away with. Agency nurses work pretty hard. I would never want to do agency. I'm not knocking it at all. I couldn't go into a building that I didn't know and just start working and taking care of people. It would not be my thing. That would not be my scene. I need to know what I'm doing. And I commend people that can do that, and I know that there's money to be made doing that, but that is certainly not for me. And the hassle with that, from my perspective, is that each time someone comes in to work from agency, you have to make sure that they have their logon, that they have their password, that they know how to use the system. So it's almost like a mini orientation too. Some agency people worked there frequently. They were frequent agency nurses, and they came in and did an amazing job. The thing is, I worked in a building that had med techs, and while that's really appreciated, it doesn't negate the responsibility of the nurse to do insulins, AccuChecks, vital signs, and blood pressure meds, and the PRNs and things like that. So you're talking about a nurse to patient ratio of like 50-1. And that's a lot. That's a lot. It's hard enough when you have 30-1, and that's a really common ratio in a long-term care facility. And this was a skilled nursing facility, not just long-term care. We had IVs, trachs, all kinds of things going on. We had a lot of dialysis patients. We had a lot of high-need patients. And in addition to that, COVID was running rampant. Now, we were kind of reaching the end of COVID, but not the end, but it wasn't new anymore. I mean, we had been dealing with it for a year by the time that I ventured into this role, essentially. But I really had high hopes for this position. There were 3 ADONs that were supposed to be in the facility, 1 DON, and an administrator, and a bunch of other managers. And ultimately, each ADON was responsible for a specific unit. We had a memory care, we had, a Medicare unit, and then we had, your long-term care side. And essentially, I was responsible for the long-term care side, and that was maybe about 80 patients. And also, I was responsible for the veteran program. We had a program where we had a lot of veterans in our facility, and we were making sure that they were getting to their appointments, that they were getting the cares that they were supposed to be getting. Everybody was supposed to be getting that care, and we were checking on all of that, but there were stringent regulations for veterans that needed to be monitored pretty closely. So I got that job too. In addition to that, though, when people would call in, maybe I had to work the floor too after working for 12 hours. And so I worked with a really good team of people, but I've heard people say that managers don't help on the floor. There were days when I did sit in the office in front of a computer because I had a lot of responsibilities to do. But in most facilities that I've worked at, the managers have a rotation where they're supposed to help in the lunchroom, do walking rounds. I've always answered a call light if I saw one and I was not in the middle of doing something else. Because I can get somebody a glass of water, I can fix somebody's covers, I can put somebody on a bedpan. I don't always have time to stop and put somebody on the toilet. I gauge those experiences. There's been times when I have time to quickly put someone on the toilet if I know their activity level will let me do that, but there's sometimes when you don't have 30 minutes to give to a patient who will need that 30 minutes, and that's unfortunate, but it's true. I spent a lot of time checking admissions that were done to make sure that everything was in place. I spent a lot of time checking charting to make sure that it was done. It wasn't. I spent a lot of time, looking at incident reports and, those sorts of things, and looking at how the floor was running. I got really burned out really fast. I felt like I was drowning, and I didn't think that that was for me. And I thought I would get more training than I got, but I spent a lot more time on the cart and kind of got baptized by fire, as they say. So I just got thrown into it, and it was a sink or swim sort of situation, and I ended up sinking a lot. And the management changed in the middle of all that too, which complicated things because, every manager wants a certain type. They want different things. Within the regulations, they want different things. And some good things came out of it, and some things were it just wasn't working for me. I was asked when I did give my notice to stay and check charts because it turns out I'm pretty good at checking charts and, following up with that admission stuff. Maybe that comes from all the admissions I've done over the years. And it turns out that, I was good at checking charting. So they did want me to kind of clean that up a little bit. But I did transition into hospice from being a manager. And I am really glad that I did that because at the time that I left long-term care, I was really beginning to be burnt out, and it didn't matter what facility I worked at, the feeling just wasn't going away. So after that experience, I just never considered taking on a management role again. And the other thing that happens is if you promote up within a facility and you become a manager, or you promote up within a team and you become a manager, it changes the dynamics of your working relationship with the people that you are working with, because I'm not a confrontational person. I don't want to make people do their job in an aggressive way. I want us all to be adults and do our job. And when you're working beside someone, you don't necessarily see everything that's not getting done. You don't see the things that the people that our managers are seeing. And it is hard to tell the people that you love to pieces that they need to get it together and change what they're doing. And I'm a helper. I want to help everybody. But, we all have to do our own responsibility. And I think that that's another thing that's hard about being a manager, is that you have to be able to delegate. You have to know when to say, this is your responsibility and you need to do it. And you have to know when you can jump in and help. It's a balance. It's a fine balance to be a manager. And I've had really great managers, and they were jumping in there, helping all the time. But I will tell you, in addition to that helping and jumping in and doing the floor, you're still responsible to get the things done that you're responsible for in your own role. So that can really burn a manager out quickly. And that's why sometimes you'll see a turnover of managers as well, because it's a lot. It's a lot sometimes what a manager is supposed to do. And we're still nurses at the end of the day. We're not just managers. We're nurses, and we do nursing things too. And that never stops. No matter what role you do in nursing, no matter where you progress to, at baseline, you're still a nurse. At baseline, you're still responsible to do nursing things, CNA things. Understandably, the more responsibility you get, the less hands-on that you're able to do as the person who is doing strictly hands-on. I love my CNAs. They are in the nitty-gritty of it, and they do a lot. And they put their bodies through a lot, and they go through a lot emotionally and mentally, and they are truly a backbone to our system. And I love the nurses that I work with and have worked with in the past. When you have a good team foundation, you can really lean on each other when you're in a place where you need help or they need help. And it's a really beautiful thing when you have a cohesive team. And I've learned to really know my doctors over time too. And it's a very few and far between that I have had to deal with a doctor that I didn't have a great deal of respect for. I was just thinking about, all the team roles that you play, but management has been the thing that has always been something that scared me. But as I get older, I think more about it, and I think about jumping into those roles, because there comes a point in our nursing careers where our bodies just can't do the things that we did when we were younger, and that is a fact. I mean, when you get to be 50, and I'm approaching, lifting on patients is just, It's not as easy as it was, and you're not as fast as you were when you were in your 20s, say. And believe me, in my 20s, I was probably a lot stronger and faster than I am in my late 40s. So I think about those things. How do you feel about management? Have you had management experience? How did you handle that? How did you handle times whenever you maybe promoted up and you had to manage your friends? How did that go for you? And I would love to hear about it in the comments. Give me some tips and tricks and tell me what you think about it. Let's talk about it. I thank you for watching. I hope to see you soon.